Hi everyone, my name is Anita Wallace and I'm Chair of the Lymphedema Support Network. And I'm delighted to welcome today Dr. Catherine O'Leary, GP from Oxford, who is joining us for the fourth in our series of our expert question and answer sessions. So welcome Catherine, and thank you so much for agreeing to join us. So why is lymphedema not treated like other chronic conditions such as asthma or diabetes? People with these conditions get called in for annual reviews. Shouldn't there be a proper pathway of care like this for lymphedema?
So that's an interesting question, and that goes to a bit about how general practice is organised, and in particular in some ways in how it's funded. So general practices are funded to look after the sort of core medical care of patients, the day-to-day care, but then also there's a set of quality outcome measures that they need to try and achieve. And in return for achieving these measures, that's how they gain some of the other parts of the funding that enable general practices to function as essentially small businesses. So at the moment, there are quality outcome framework for various clinical conditions, like, as you've mentioned, diabetes, asthma, chronic kidney disease, epilepsy, mental health. But currently, there isn't one that covers lymphedema and chronic edema. Now, hopefully, I guess, the solution in the future would be if there was quality outcome framework, a measure for chronic edema or lymphedema, because then there would be kind of national targets that would be set that that GPs would need to sort of complete it, and in return for that they would have funding for the resources to supply those services essentially. So I think first steps to that is it goes back to knowledge about how many patients out there have chronic edema or lymphedema. I think, and I know Prof Mortimer and many others think, that the prevalence is probably a lot higher than we realise. So I think it goes to looking at how much of this is out there, then educating, probably the commissioners into what we know about early treatment. And if we treat these patients early, we will reduce the complications rate in the future, which will bring many benefits to the NHS, but from a funding point of view will bring cost reduction for the reduction, hopefully cellulitis admissions, leg ulcer treatment and all of those things. So I think we're a way off it yet, but if we, as I said before, you've got a wonderfully enthusiastic lymphedema community out there, and I think the message is getting through, and hopefully in time to come, it may be that there could be possibly a QOF measure on chronic edema, and maybe just something simple like having a chronic edema register at the practice and offering information to the patients, and that would be the start. So you'd be making the diagnosis and signposting patients, and from there then I think other things would kind of blossom, hopefully.
Lovely, thank you Catherine.